Under the diagnosis, no, because that's not appropriate to what we're doing. Right. The things that you might do is add the anemia, because they're going to, if they have a chronic anemia condition, it could be, it could be a delay in their muscle re-education or their muscle strength coming back. Any of those things.
So are we getting feedback? I mean,
You will get feedback.
If we're doing it correctly. You
bet you.
I know that some of the nursing, some of the RNs out in the field have started using it already, and they've been talking to their clinical manager. Am I doing it right? And so they'll pull up the patient and go, yeah, but what they were doing with the second piece for 1016. They weren't putting the diagnoses in, so now they're going back and saying, but we need this as a diagnosis, not just they had multiple meds changes. If they had a change in Lasix, it's because more than likely CHF. And that CHF best be in that discharge summary or H&P.
What is going to be effective on this one?
Today. It's because of the backlog. Because the current system has always got 5 to 10 days backlog, depending. That's why.
What about the patients that are coming straight from home, like they went to an MD office? Is this NA for
We're
everything?
going to get the information, and I made that comment, and Lydia said that they will get it within 24 hours.
No, I mean the patient. They never had a hospital admit at all.
No, they're going to get it from their doctor, from the doctor's office. Every doctor's office has a problem list for their patients that they keep on going.
Okay.
And I can tell you, if it's a heritage patient, they really do good record, and we can get that from TouchWorks, because most of us have TouchWorks. Harry, do you and Stephen have TouchWorks?
We have access to TouchWorks.
I knew that. TouchWorks enables us to go into any doctor's office on any patient that they have.
So it's going to be NA for the first one, and then you'd still answer the other 3 questions.
Correct.
Okay.
Yeah. And if they do, and it's not in all docs, that's when contact Harry or Stephen. They can go into TouchWorks and they can pull the diagnoses out of TouchWorks.
I just want to check, because a lot of it on the Oasis, if you click no hospital admit, it grays out most of the other boxes.
It used to gray out 1010 and 1016.
Right.
It never grayed out 1010 and 1012.
Right.
But it doesn't gray out 1016
Right,
because
but
there has to be a
that's
change.
why not?
They're assuming there's a change in the patient's condition, which is
Hope
why
so.
they need home care or something like that. Although every once in a while, it's the appropriate answer if they went to a skilled nursing facility and nothing really changed is no, because it's supposed to be within the past 14 days.
Mhm.
Right, Kelly?
Right.
But that's beside the point.
The nursing and the intake, their information, or is it all in all docs, most of them? The diagnosis, you put it in?
I'm going to say there's a good chance.
Okay.
There's a very good chance that what the intake person puts in is in all docs, because they're writing up their summary from what they're seeing in the hospital record. And they pull off the history and physical and the discharge summary, and oftentimes an op report, and sometimes x-rays, and sometimes consultation reports. So I'll go in and I'll see consultations, I'll see the history and physical, and then I'll see consultations, and then I'll see the discharge summary, and I'll see a medication list that is 25 pages long. Because every time it's changed, they make a new one. But yes. So there is, what percentage would you say that it was probably accurate to all docs, Deirdre?
What accurate?
The intake note.
I don't know. I just know that it's not accurate enough,
Okay.
but I can't give a number.
They can't make it up. And they might make it up, especially, I think the liaisons are probably more accurate, but if it comes from intake, it's not going to be as accurate.
Some could be typing error too.
Correct.
I just found one left application put in right.
Hate it when they get the wrong side.
So can you just help clarify, for example, if they have a diabetes diagnosis, and so they are going to be diabetic foot care
Correct.
on their problem
And I
list.
need diabetes in their
So then,
diagnoses.
so then you would want that on M1016, because that's part of what your care is providing.
Well, that's part of, it's not a change that occurred. So I'm not gonna put it in 1016, but I am gonna put it in 1022. Am I correct, Kelly? Okay.
The only thing is, I'll just share with, when I was trained, that they said often when they go to the hospital, that they'll put them on insulin, a sliding
Correct.
scale, so that is a change, and then when they
If
come
they
out,
did,
they are
that's
off.
different, but you don't know that, so I'm not gonna make that blanket. But you're right, and they do. For some reason, they love putting people on insulin when they go to the hospital.
And then they send them home.
Makes it
without
so much
nurse,
easier.
No insulin.
Yeah, of course they do.
And no scale.
Yeah. Makes no sense.
Well, some doctors don't give a scale, so I called the doctor and they said, no scale, just take 14 units.
Yeah.
And have a nice day.
That's it.
And make sure you have lots of chocolate bars close by.
Well, you see, the therapy notes are in all docs too, so you can
Yeah.
actually look at their treatment.
Yes, you
plans.
can.
Sometimes.
Yeah.
Sometimes not there, but just saying. If you don't see it, just don't do it.
Yeah.
One-time visit, discharge on all.
Like with all changes, it's going to seem like it's a little tough until you get used to it, and then it's gonna be just like you do everything else.
I don't think so.
Yeah, I don't think so.
I think this is gonna be extremely time consuming.
Yeah.
Calling the doctor sometimes takes 15 or 20 minutes.
You should call them anyway, though.
And then to ask them to fax something, and then give them all the fax information, getting first and last name,
Take
and
3
then
days for
typing it
them
all.
to.
This is gonna be extremely time consuming.
Well, like we said, if it's something that you can leave a message on the PAs and you know the name of that PA, and then you add it to the, just add it to the diagnosis list, and it goes on the 45 and the physician signs it, the physician's corroborating that.
If you get the general operator, you can always say, hey, what's this doctor's
PA.
assistant's full name? Transfer me to the voicemail and just call it in from there. That's it.
That would be the easiest way
And
to do
then
it.
just leave your message that if you guys don't like my plan, give me a call.
Yeah.
And if I don't hear back
Within
from you,
24
I
hours.
assume you agree.
Exactly.
Have a nice day. That's indirect.
And don't call me, I'll call you.
I just did. I love that. I'm gonna quote him on that one.
Yeah, it's always been a struggle for therapists who are independent in practice outside of the realm of home health to go into home health where we have all these regulations. I understand.
Yeah, please.